Hello everyone. Welcome to Let's Talk Health on sepsis. Today we'll be covering essential information on sepsis for both patients and healthcare professionals. I am Dr. Nickhil Vangapally. I'm an emergency physician consultant and I head the Department of Emergency Medicine at Star Hospitals, Nanak Ramguda. So I'm here with my colleague, Dr. Imran Shareef. Imran, over to you.
Thank you, Nikhil. So I'm Dr. Imran Shareef. I'm the clinical lead for emergency medicine at Star Hospitals, Banjara Hills. I am a qualified emergency physician. I did my initial training in India, and then I moved to the UK, where I trained for 6 years to get my fellowship of the Royal College of Emergency Medicine. I subsequently worked in the UK for about 3 years as a consultant. I moved back to India about 6 months ago, and I joined Star Hospitals. Today we are going to talk to you about sepsis, and sepsis is a topic of great interest of ours, especially because of the burden of disease. It is a rapidly increasing disease with a very high mortality. What I mean by that is that if you look at India itself, 3 million people die every year. 3 to 4 million people die every year of sepsis. And through this Let's Talk Health, we are trying to increase awareness both for patients and for healthcare professionals. So Dr. Nickhil, if we can start off with, what exactly is sepsis?
Sepsis is a very serious condition. It's a life-threatening condition usually triggered by an infection. So where the body responds and it starts attacking its own tissues and organs. So it may lead to shock, multi-organ. Hello everyone. Welcome to Let's Talk Health on sepsis. Today we'll be covering essential information on sepsis for both patients and healthcare professionals. I am Dr. Nickhil Vangapally. I'm an emergency physician consultant and I head the Department of Emergency Medicine at Star Hospitals, Nanak Ramguda. So I'm here with my colleague, Dr. Imran Shareef. Imran, over to you.
Thank you, Nikhil. So I'm Dr. Imran Shareef. I'm the clinical lead for emergency medicine at Star Hospitals, Banjara Hills. I am a qualified emergency physician. I did my initial training in India, and then I moved to the UK, where I trained for 6 years to get my fellowship of the Royal College of Emergency Medicine. I subsequently worked in the UK for about 3 years as a consultant. I moved back to India about 6 months ago, and I joined Star Hospitals. Today we are going to talk to you about sepsis, and sepsis is a topic of great interest of ours, especially because of the burden of disease. It is a rapidly increasing disease with a very high mortality. What I mean by that is that if you look at India itself, 3 million people die every year. 3 to 4 million people die every year of sepsis. And through this Let's Talk Health, we are trying to increase awareness both for patients and for healthcare professionals. So Dr. Nickhil, if we can start off with, what exactly is sepsis?
Sepsis is a very serious condition. It's a life-threatening condition usually triggered by an infection. So where the body responds and it starts attacking its own tissues and organs. So it may lead to shock, multi-organ failure where the organs can get affected and perhaps sometimes may lead to death as well. So I would also like to tell who are more prone to sepsis. Yes. So usually the elderly and the people who are immunocompromised, where their immunity is not that great, they're on and having chronic conditions and bedridden. And
Okay.
so these people are more prone to infections, and when attended, that might easily progress to sepsis.
Okay.
So, Imran, how do you identify sepsis?
So, identifying sepsis is where the challenge lies, both for patients and healthcare professionals, because the symptomatology, the kind of presentation can really vary between people. Like you were mentioning, Nikhil, the kind of people who are prone to getting sepsis are usually the elderly or patients who have a low immunity, diabetics or very small children.
Yes.
And women who've delivered
Yes.
or people who've had surgery. So The presentation is so varied, so it is sometimes very difficult to identify. However, there are some features that are quite common. So most people will have a fever,
Yeah.
along with shivering. You can have a rapid breathing rate or a rapid heart rate. You may actually show signs of of the organ that is infected. For example, if you have a lung infection,
Yeah.
you could have cough, breathing difficulty, a lot of phlegm coming
Phlegm.
out. If you have a urine infection, you may have burning or stinging when you pass urine. Or the actual amount of urine that comes out actually may go down. If you have an
Yes.
infection within the abdomen, for example, you may have vomiting or diarrhea or severe pain in the abdomen. Apart from this, there are some features that you really need to be mindful of. Generalized weakness. Someone who is normally active suddenly becoming bedbound.
Yes.
Weakness and a lack of appetite. Confusion is somebody who's
Yeah.
normally completely fine suddenly starts to display signs of confusion and disorientation along with the fever. So these are some of the signs and symptoms that can point towards sepsis.
And what is the best way to manage this condition?
The management of sepsis actually begins with identification. And now that is where a lot of research around the world has gone into. In fact, I know from US and the UK data that there are campaigns that governments have started for people to actually identify sepsis. Sepsis kills, for example. So the management actually starts with identification. So once somebody comes to the emergency department, there are some features, for example, your heart rate, your temperature, how confused you are, how much urine you're making, and what your blood pressure is. So we try to use these parameters, and especially here at Star Hospitals, we have a sepsis screen tool.
Yes.
So we use it to identify patients who are at high risk of sepsis. They may not have sepsis eventually, but this tool helps us identify which are the patients who are actually more prone to having sepsis. And once we've identified that, the next thing we do is get an IV cannula in so that we can send some blood tests off. So we send something called blood cultures. That is, we send your blood to the lab to see what kind of bacteria is actually growing within your blood. It helps us to target that bacteria with antibiotics. We also send something called a lactate, which tells us how well oxygen and blood are being delivered to your organs, your vital organs. We then move on to giving antibiotics. Now, this is probably one of the most important steps, is to choose an antibiotic that would target the kind of bacteria that is causing sepsis. And often we involve our primary specialty teams in that decision making. The key is to hit fast and hit hard. So we need to get these treatments done as soon as possible. Because as we mentioned, sepsis is something that a patient can rapidly deteriorate along with sepsis.
And what do you think is the ideal time to administer antibiotic?
So the research has shown that earlier the antibiotics are given, the better outcomes. So we aim for most patients, especially for the ones who are very sick, to give the antibiotics within 1 hour.
Yeah. And what is the ideal place for care for the patients who are admitting in the hospital with this condition?
Yeah, so I think the care starts from the emergency department, and then we move on to intensive care. A lot of these patients will require intensive care. There is advanced monitoring that you may require. So in addition to the blood test and the antibiotics, we may need to put a catheter to drain urine to see how much urine is actually being made. We may need to give fluids. So what often happens with sepsis is that the blood vessels that carry oxygen and blood to vital organs, they're unable to do that. So we sometimes need to give additional fluids or medications such as noradrenaline and vasopressin to actually squeeze the blood vessels to get the blood to the vital organs. So a lot of these medications need to be followed up in intensive care. So to answer your question, I think most of these patients will end up in intensive care for a period of time. I mean, to think of the magnitude of the disease, patients with a low blood pressure and sepsis, 50% of them may actually die. So there is a very high mortality. And the only way to prevent that is by giving good care early and fast.
Yeah. And we often talk about organ failure as a consequence of sepsis. So if the organs have been affected. So the most common organs being the lungs, the kidneys, heart, and brain itself. So what are the treatments we have to support those failing organs so that the person will recover from sepsis?
Thank you, Nickhil. That's a very good question. So a lot of these patients, in addition to the treatment we give in the emergency department, will require advanced treatments in intensive care. For example, if your lungs are failing and the oxygen that we give is insufficient, we may need to put these patients on a ventilator, whereby we support the lungs in the process of recovery. We may need to, for someone whose kidneys are failing, we may need to put them on temporary dialysis along with our nephrology colleagues to try and get the impurities out of the body. In addition to all of these, we also have the capability of something called ECMO, wherein someone who is so unwell that despite the ventilator, despite blood pressure raising medications, they're still unable to hold their blood pressures. So we have a system whereby we can take the blood out of the body into an external machine that will add oxygen and actually pump blood back into the body. So these are advanced therapies that we have available at Star Hospitals.
So next question is, how do we prevent this? Is there any way that this can be prevented?
Good question. So, in terms of prevention, some of the basic things that we can do is practice good hand hygiene. So a lot of infections are passed on to the elderly by younger people, either through contaminated objects or even through contamination of the hands. So simple things like hand washing, keeping a good personal hygiene and hygiene around you, taking regular vaccinations. So we have pneumonia vaccines available, meningitis vaccines. So people who are vulnerable, preemptively giving these vaccines also helps.
And of course, early involvement whenever they have an infection, seeking help immediately. So calling to their doctor or attending to the emergency would prevent that progression to sepsis. So that's also. And in a healthcare setting also, how we can prevent is like practicing good hygiene so that the infections are not transferred, like implementing effective infection control practices and identification of infection early and treating them appropriately so that it doesn't progress to sepsis.
Absolutely. And I think one of the problems we face is people often come very late in their disease process. So, when you identify any signs that someone is unwell, I would suggest seeking medical help early, especially in the group of people that we mentioned earlier.
And do you want to talk about antibiotics and drug resistance a bit here? Because as we're talking about infection and early management, so people consume a lot of antibiotics, and as a consequence, there are certain outcomes of drug resistance. So would you like to enlighten about it?
Yes, absolutely. So I think one of the major challenges that we face in this day and age is the fact that a lot of the antibiotics that were once useful, unfortunately, a lot of those antibiotics, a lot of the bacteria have become resistant to those antibiotics. So we actually have very few antibiotics that are effective. And one of the reasons is that often people take antibiotics for conditions that don't really need antibiotics. And this is, I think, also aimed at healthcare professionals, where we have to be very, where our antibiotic choice has to be justified, and unnecessary antibiotics should not be prescribed, because that is one of the main reasons why we are getting these resistant bugs.
So it's always better to consult your doctor and get the antibiotics started rather than starting on your own, because they're easily available over the counter. So because your infections might not be caused by a bacteria every time, it might be caused by a virus. So where antibiotics won't have any effect on it. So try not to use the antibiotics. Always do use them after consulting your doctor. So to conclude this topic, summarize this. So sepsis is a serious condition which has to be promptly recognized and treated because it progresses very quickly and might have very serious consequences, like the patient might go to shock or may have organ failure, may have an extended stay in the hospital because of sepsis. or perhaps may even cause death. So there are good management. It can be managed very appropriately if identified early, and it can be prevented also. So and for the healthcare professionals too, early recognition by following the latest guidelines, we can refer to surviving sepsis
Yes.
campaign, and we can use the case review case studies, and following up with catching up with the latest research. I think we can work together for better outcomes and save lives.
Absolutely. I think the surviving sepsis guidelines are a especially for the healthcare professionals, are an extremely useful resource to learn about the management of sepsis. So I would really recommend going through the surviving sepsis guidelines, the latest ones.
Thank you.
Thank you.